Welcome back. Today we are talking about the top 5 symptoms in early pregnancy. So if you are newly pregnant or you're about to become pregnant, this is the episode for you. We're going to go over the basics and how to manage those symptoms. So if you're new to our channel, Dr. Sarah and I are family doctors in Victoria, BC. We specialize in maternity care, labor delivery, and postpartum care and newborn care. We're doing a series of videos to kind of give you more information. If you want to get more information, subscribe below. We also have some great links in our show notes, and one is a guide for preparing for pregnancy. So make sure to download that and have a look over that.
Also, we ask that you have a quick look at our disclaimer below. Let's get started.
Yeah. So the first symptom that strikes women is often fatigue, and this fatigue or tiredness can be unlike anything that you've ever experienced before. It's truly amazing, really, how exhausted and how just sucked of life that you feel in that first trimester of pregnancy. We think this is because of the hormone progesterone, which we'll be talking about a lot today, and its effects on our body. Also, our blood volume increases dramatically, so we're essentially kind of have anemia or iron deficiency early on in pregnancy until our body catches up. So do not feel bad. Do not feel guilty if you can't get to the gym and do your regular exercise. First trimester is kind of a bit about survival. So rest when you can, have naps if you need to. If you've got a toddler at home, I know I did this when I was pregnant with my daughter, is my son and I would play imaginary games, and I was always the imaginary baby. So I couldn't move. So I would just lie on the couch and be like a baby, and he would come and feed me and change my diaper. He wouldn't actually, but you get the gist. I don't know if you had any fatigue in your pregnancies. But
Oh yeah. My first pregnancy surprisingly was the worst. And I would fall asleep literally on the couch every night after dinner.
Yeah.
And wake up in the morning.
Yeah, totally. So it's very normal. And generally speaking, once you hit about 12-ish weeks of pregnancy, it improves dramatically. Second trimester, your energy comes back. You feel more productive again. So again, no guilt. Just survive. If you can go out for a 10-minute walk, amazing. But just do the best you can through this challenging symptom.
So the second symptom that a lot of women experience, especially in the first trimester, is constipation and bloating. So progesterone causes fatigue, and it can also contribute to the slowing of your gastrointestinal tract, which leads to the constipation and the bloating. So there's a lot of easy things that you can sort of fit into your day that can help combat these symptoms. So making sure you're well hydrated, drinking lots of water, just carrying a water bottle around with you. And there's lots of people out there who are going to tell you how much water you should drink. Basically, you just need to drink so that your urine is light yellow to clear.
And drink to thirst.
Yep.
So manage your thirst.
Yeah. So that's basically how much water to drink. Drink to your thirst. Drink till your water is clear or light yellow. And also moving your body. So getting little walks in, getting up and around. Even if you can get just a 10-minute walk in your day, movement can actually help the bowels move as well. The other thing we often make sure women are doing is having high fiber intake. So that can be with your food, and that can also be with something called psyllium. And psyllium is the main ingredient in Metamucil. So if you are like my husband and really like Metamucil, just make sure you have a tablespoon or 2 of Metamucil every morning.
Poor Hagen. At least he has nice soft bowels. The other Benefiber also works. There's lots of different options.
Yeah.
So a question that often women ask about early pregnancy is, can I still have my coffee? 100% yes, you can still have your coffee. Don't have 6 cups of coffee a day. Nobody should have that much. But 1 or 2 cups of caffeine are totally fine. Whether that's tea or coffee, no big deal.
Yeah.
And the other thing about coffee is it also helps stimulate your bowels. So a lot of women find that cup of coffee, don't start coffee to manage your bowels, but if you want to drink coffee, then it will actually help stimulate your bowels and help you manage your constipation. So that's a great kind of little tip if you are a coffee drinker. So again,
like this girl.
Not a ton, but a little bit is fine.
Yeah.
And it will have the added benefit of getting your bowels moving a little bit more effectively. The other magic medication, it's a medication you buy at the pharmacy, is something called Laxaday or PEG. The brand name is PEG 3350. It's known as Laxaday or, I don't know.
Restoralax?
Restoralax is another one. And this one is amazing for constipation. It is not absorbed, so it's totally safe for baby. It's totally safe if you're breastfeeding or when you're pregnant, and you don't become dependent on it. So a lot of the stool softeners or laxatives out there, our bowels actually become dependent on them after a while. This is not the case with this Laxaday Restoralax PEG. It's totally fine to take. Some women take it every day throughout their pregnancy just to keep their bowels nice and soft. It's really great postpartum when you're going to have that first bowel movement after you've had a delivery as well. So that's a great one that we often recommend to women who are still struggling despite the walking and the water and the fiber and the coffee. So another common symptom, and one that women often notice pretty early on, is breast tenderness. And this can be quite significant. Like, I don't know. I really struggled with this one, and I don't really have much breast tissue. And the reason is because once we get pregnant, our breasts actually start preparing for that postpartum period that we're going to be breastfeeding, and they start proliferating the ducts, and all the tissues start to increase to get ready to breastfeed our babies. And so this can be quite uncomfortable and quite frustrating, really. And I mean, so it's a real thing. Getting a really good supportive bra, but one that's not too tight, it can be really beneficial. Just the more movement that your breasts have can make it worse as well.
Oh yeah, and this is really real. Like Alicia said, I couldn't hug people in my early pregnancy. It was so tender, and that's normal, and that should improve once again you pass through the sort of end of the first trimester into the second trimester. So it's not going to last your entire pregnancy. And typically, it's not as bad in subsequent pregnancies because you've already done most of that sort of breast tissue development. So the fourth most common symptom that women have is nausea and vomiting. And this is probably one of the toughest symptoms that women have to deal with. And unfortunately, it can last throughout the entire pregnancy. We're going to actually do a whole segment on nausea and vomiting in pregnancy, so we'll get way more into it. But, basically what we understand is that we think it's related to some of the hormonal changes, especially the rise of beta-HCG. And the reason we think this is because we often see a lot higher pregnancy hormone levels in women with twins. So there's lots of different ways that we can manage this. And one of the most important messages we want to have for you is that you don't have to suffer in silence. A lot of pregnant women, and I was like this, you just want to sort of grin and bear it for the goodness of that little growing baby, but you don't need to suffer. It can really impact your quality of life. And so we've got some tips here today, and we'll come out with a new video in a few weeks that's got lots more details around it. So to start, just the basic message I say to my pregnant patients is never get too hungry, never get too full. So snack throughout the day, and don't let your stomach get really empty. And so some women even need to put some crackers, a banana, some cheese on their bedstand, and eat first thing in the morning before they get out of bed.
So another tip is sucking on something. So sucking on a candy. So Gravel makes a organic ginger lozenge, and so we know ginger has been actually shown to help nausea in many studies. And so you can suck on that ginger lozenge throughout the day, but there's also kind of nausea and vomiting candies, or just a lemon candy that's sour can often help. So having one of those in your purse or with your bag, so that if you are getting those bouts of nausea, you can certainly just grab that and put that in your mouth. That usually helps. It won't cure it, but it should help a little bit.
Another good tip is that sometimes prenatal vitamins can actually make your nausea worse. So if you happen to be anemic, or you have, not a very varied diet, and you do need to take a full prenatal vitamin, play around with the time of day that you're taking it. Make sure you're not taking it on an empty stomach. But if you've got a pretty good diet and your care provider okays it, then you can just take folic acid, and that's a lot easier on your stomach.
Yeah, the other thing I recommend is you can take a kid's chewable instead of a prenatal vitamin. Not an adult, though, because it has too much vitamin A in it, but a kid's chewable is totally fine. So if you feel like, I don't feel right not taking a vitamin, a kid's chewable plus your folic acid should be fine, and they're much smaller and much more tolerated.
Pro tip. Yeah.
Right?
Something else some women try are called C-bands. And funny story is that my parents spend a lot of time sailing, and my mom gets horrific seasickness, and she's used these, and they actually help her. So they don't have a ton of evidence in the studies, but there's clearly zero harm about wearing a little band around your wrist that hits a pressure point here. So those are worth a try. If you're really struggling and you're trying to avoid any prescription medications, I would recommend giving those a shot.
So if you've tried all of those and you're still suffering, so if you're nauseous throughout the day, you can't function, or if you're vomiting multiple times, because we do need to eat and feed our baby, the next step that we would go to is medications. Certainly check out our video when we come up with it around medications. We'll go into those in more detail, but the occasional Gravol is totally fine if you need something. And over and above that, there's a bunch of prescription options that we can offer you through the pregnancy if you need it.
Okay, the fifth most common symptom that women experience in early pregnancy is actually spotting and bleeding. So it's super common. Some vaginal bleeding can occur in almost a third of pregnancies. And although it can be really frightening, it leads to miscarriage in less than 50% of the time. So we do know how worrisome it can be for women. And even though we know the rates of miscarriage are lower, we will continue to do investigations and make sure that the pregnancy is growing as expected. So what we do depends how far into the pregnancy you are, what your gestational age is. So if you're pretty early, less than 6 weeks gestational age, typically what we'll do is we'll order a blood test and look at the level of the pregnancy hormone. So it's important to understand that the level of pregnancy hormone itself isn't helpful. It's watching it rise is what makes the difference. So we don't want you, because a lot of us, I know here in BC, can actually access these numbers, your lab tests at home. And the lab will put, sort of different categories for the hormone levels, but we're not looking at the level itself. We're looking at how it changes over time. And we expect pregnancy hormone on average to double every sort of 48 to 72 hours. So if you have spotting in early pregnancy, typically what our practice would be to get some blood work done and then get you to repeat it every 2 to 3 days and make sure that it is rising, about doubling.
And like Dr. Sarah said, this only applies in early pregnancy. So it only applies for women under 6 or 7 weeks. So if you're doing it at 10 weeks, it's not going to rise the same way. So we do not order it after 6 or 7 weeks because that's when we would move on to the next step, which would be an ultrasound. So if you're having some spotting early pregnancy and you're over about 7 weeks, then we'd order an ultrasound just to make sure that everything is progressing well and normally. Some of the common reasons that we can have spotting, if it's not a miscarriage, is what's called a subchorionic hemorrhage. So this is when you have a little bit of a bleed behind your placenta. If they're small, they will never affect your pregnancy. You don't need to go in bed rest. You don't need to do anything outside of just being a normal human being. If they're larger, then we need to be a little bit more cautious around them. But again, this is something that your care provider would talk to you about. And then the other reason is we often don't even have a reason why we have spotting in early pregnancy. We can have it. Is it from the implantation? Is it just life? We don't know. So we want to make sure that everything is progressing normally. And so that's kind of why we do under 7 weeks, those kind of repeating the hormone and making sure they're rising appropriately. Over 7 weeks, we get an ultrasound just to make sure that everything is going well.
Now, it's important to note that bleeding we do absolutely want to hear about is any bleeding that's associated with pain, especially if you have not yet had an ultrasound. Because what we want to make sure is if you're having bleeding and you're having pain, we want to confirm that that pregnancy is growing in the right spot. So if you're early pregnant, you have not had an ultrasound that confirms that that pregnancy is growing inside your uterus, that is absolutely a reason you should call your care provider right away and they'll sort out an assessment for you.
Yeah, we want to make sure that you don't have an ectopic pregnancy. And so that can be an emergency. And so that's why we are if you're having bleeding and you're having pain, please call your care provider.
So that rounds out the top 5 most common symptoms in pregnancy. And we hope you found this helpful and just sort of navigating your way through the moans and groans of early pregnancy. Now, some women, believe it or not, sail through their first trimester without any of these symptoms. So if you're pregnant and you're not having any of these symptoms, that's okay. Just consider yourself one of the lucky ones.
Yeah. So make sure that you check out our show notes below. Again, we'll link that preparing for pregnancy handout. So if you're early pregnant or you're not pregnant yet, that's totally applicable in all of those cases. Also, we'll link to a couple of other videos that are of the same genre, I guess we should say. So check these out as well. And make sure you subscribe below because the more subscribers we have, the more we know people value us and we'll keep making content.
Thanks, guys.
Have a great day.